What if someone suddenly can't smile, can't lift an arm, or start speaking strangely? Every minute during a stroke, nearly 1.9 million brain cells can die. Acting quickly can save a life and reduce permanent disability.
The easiest way to recognize a stroke is to remember the word FAST. F is for face. Ask the person to smile. Does one side of the face droop or look uneven? A is for arms. Ask them to raise both arms. Does one arm drift downward or feel weak? S is for speech. Ask them to repeat a simple sentence like, "Today is a sunny day." Is their speech slurred, confused, or difficult to understand? T is for time. If you notice any one of these signs, call your local emergency medical service immediately. Do not wait to see if the symptoms improve.
Other warning signs include sudden numbness on one side of the body, sudden trouble seeing, dizziness, loss of balance, or a sudden severe headache with no obvious cause. While waiting for help, keep the person safe and comfortable. If they become unconscious but are breathing normally, place them in the recovery position. Do not give food, water, or medication unless instructed by healthcare professionals. Remember the time when the symptoms first started, or when the person was last known to be well. This information is critical because some stroke treatments are only effective if given within a limited time.
A stroke is a medical emergency. Recognizing fast and acting without delay could save a brain, save a life, and help someone recover with fewer disabilities. Share this video because knowing fast today could help you save a life tomorrow.